Hello to you all. Welcome back in Decoding Homeopathy. This is Dr. Nitesh Jain. When we listen the word repertory, we are also going to see the word rubric. Now we will see what exactly the rubric is. So the topic is rubric. The word rubric, it came from the Latin word rubrica. This word rubric basically means it is a sort of repertorial language. Now, as we had already seen that repertory is an index of homeopathic materia medica. When homeopathic materia medica, it was the collection of data. When it increased, then index will also increase. So to keep the index short, one way was formed in which the symptoms were made short into words, but then the essence was intact. And this form in which the symptoms were made short, this was called as rubric. So in each and every sort of repertory, we mostly see the rubrics. This is the reason we can call it as rubric is the repertorial language of a symptom. Now the rubrics are of various types. This can be cross references, identical rubrics, similar rubrics, then the clinical rubrics, we also have the pathological rubrics, and so on. So rubrics, as we had seen, it is the repertorial language of the symptoms. When we go to the cross references, we see that in some form of repertory, one rubric has been there, and also in the bracket, we see some other sort of the rubric that is called as the cross reference. That if at all we are going to use one rubric, we shall also keep in our mind the next rubric. That is called as the cross references, in which the meanings are too close to each other. Then we have identical rubric. In the identical rubrics, both the rubrics are same, and the drugs along with their the gradation are also same. But then the rubric may seem to be a bit different, but the essence is same. Then we have similar rubrics. In this, the two rubrics are too close to each other. Then we have the clinical rubrics. In this, the clinical rubrics are those rubrics which are having its foundation in the clinical world. When we speak about the pathological rubrics, we see that these are those sort of the rubrics in which we find only the pathology or else disease diagnosis. So, in this way, we can see that this is the sort of rubrics and they are of various types.